Hi, I'm Dr. Adarsh. I'm an orthopedic surgeon and a joint replacement surgeon at Sunshine Bone and Joint Institute in Hyderabad. I also head Team Orthrobotics, which is the robotic joint replacement division of Sunshine Bone and Joint Institute. We are proud to have 3 different types of robots in our operation theatre in Sunshine Bone and Joint Institute because we feel that each and every robot gives us some value in different ways. I think everybody is aware that robotic surgery is here to stay. Patients are having quicker recoveries and less pain post-surgery. They're getting beautiful results. It gives us lots of accuracy. But there's always a confusion about the different types of robots. So today I want to speak about our 3 friends. Over here we have the Stryker MAKO robot, we have the Depu Johnson & Johnson VELYS robot, and we have the Curexo, also known as the CUVIS robot. So I just want to briefly tell you about the differences between the 3. The Stryker MAKO robot is a semi-automated robot. It means that the surgeon is still doing the surgery. So the saw is attached over here, the robotic arm. The robot locks into the plane of the cut which we're supposed to take, and the surgeon is then free to use the robotic arm, the saw, but within that plane, and it has a haptic boundary which does not allow you to go outside that plane. So this is the Stryker MAKO robot. It's a semi-automated CT based robot. So you need to get a CT scan to get a 3D model ready for it. Coming to the VELYS, this is the Depu VELYS robot, also a semi-automated robot. This is an imageless robot, means you don't need a CT scan. You just paint the bone intraoperatively, we call it registration, and then the 3D model is formed during the surgery. And then again the robotic arm which is attached over here, it locks into the plane and you take the cuts.
The difference between this and the MAKO robot is that the VELYS does not have a haptic boundary control.
Coming to the CUVIS, which is known as the Curexo robot outside of India. It's known as a CUVIS robot in India. This is again a robotic arm. This is a fully automated robot, and it's also a CT based robot. So we take a CT scan, a 3D model is formed patient beforehand, and then when we're in the surgery, we decide which parts of the bone have to be cut. And there's a burr which gets attached to this part, which starts to mill away at the worn out portion of the bone, and then we put in the implants. Also, you may notice that each of the robots has its own panel over here. There's a different console which is connected to a camera, and the camera is the same for all. This is the CUVIS camera, this is the MAKO camera, and this is the VELYS camera. The reason for that is when we're using the robot, the machine has to know where we are in terms of space. So when you're moving the leg, when you're taking the saw cuts, the camera should be able to see the sensors which are attached to the leg. So that's how these cameras help during robotic surgery. So to summarize, the MAKO is a CT based semi-automated robot with a saw. The VELYS is an imageless, that's non-CT based semi-automated robot with a saw. The CUVIS is a CT based fully automated robot with a burr. So that is the difference between the 3 robots in our center.